excited to be part of this afternoon webinar. This is our cup of tea. So join us for this cup of tea. Let's have fun and let's make this session lively. We are going to go the usual way. Barbara will start us off. Then we'll see what to do after she starts off. We hope by the time it is sunset, we shall all have submitted an abstract, because that's the essence, to submit an abstract for presentation. So a quick guide is that it will be an introduction, the various components, and then we do a small exercise, TBC style, and then we'll see whether we can start writing one, and then I will tell you how to make it quick, and keeping it quick, or writing an abstract quickly and simply using AI tools. AI tools. You will please learn from us this afternoon. Moderator, I know we have 45 minutes starting now. So allow me to do one thing. Now that you have introduced Barbara, who is going to share? Barbara, you share the PowerPoint or I share? Let me share because it's on the screen. So allow me to share the screen, and then I hand over to Barbara to take it to do the intro. And when she gets tired, she'll hand over the baton. So I'm sharing the screen. Barbara, over to you. And there is the screen.
Thank you very much, James. Just waiting to see the presentation reflected.
Okay, there you are.
Thank you very much. Thank you. So, as Caris Karaoke, we call him Caris here, has stated, we are very excited to be here today and to be part of this forum. Hello, everyone, and welcome to today's webinar session. And today we are going to turn your day-to-day work into something big, a conference presentation. As it has been rightfully stated, my name is Miheso Barbara, and I work at the Kenya Medical Research Institute as a research scientist and a clinical trialist, and also co-lead the Cochrane Kenya office. So we are hoping that Karaoke and we are going to help you share your health innovations, challenges, and even success stories at the conference. Success stories are also a way of communicating the different evidences that you have. And specifically, we need you to submit quality abstracts for the second Nairobi County Health Conference. So we are so excited. Yes, you can. And you already have the content with you. Our work today is just to help you put it together in the right structure and with confidence so that you have it in an abstract. And let's dive in. As Caris has displayed, that's our outline for today, and we won't dwell so much in that. You can go to the next slide, please, Caris. And I want us to start with a small, quick exercise. So what is your story? What is that one thing you or your team did recently that made a difference in healthcare? Yeah. What one small thing have you done? It doesn't have to be huge. Maybe you reduced a missed opportunity in terms of TB treatment. Probably you've trained CHVs to help you support different programs and you've seen an impact in it. Maybe you've reorganized in your way and you've organized your ward in a better way, and there's a better and efficiency in the way you're doing your work. So what is your story? Quickly, just one statement. We can take 3 minutes. And after 3 minutes, Carissa, I would kindly request for you to read some of those stories. Like, what's that one thing your team has done? The 3 minutes start now. You can use the chat box kindly. Anything. It doesn't have to be major. What have you done that has created impact or a difference in your work in healthcare? You're looking forward to see some answers flowing in. Anything, Caris? Is there any response?
Checking. Not yet. They're still figuring out where the chat box is. Mm.
Feel free. We want to make this as interactive as possible. Uh, Anything?
Yes, no,
Lovely.
they're coming in. They're coming in,
Okay.
Barbara.
Awesome, awesome. 3 minutes
Mm.
ticking.
Danny is saying that he has developed protocols for the unit.
Awesome.
Mm-hmm. Emmanuel is still welcoming people to the webinar. Thomas is saying, I've managed to review several proposals for researchers.
Wow.
Maybe he should share his experience.
Yes, great stories. Yeah.
Mm-hmm. Just Ross Duo says monthly data review. Mm. Hey, they're coming so fast and furious. Mm-hmm. Amu is saying efficient delivery of chemicals, delivery of pharmaceuticals to corporate. That's a marketer. Where Daniel Nono is saying integration of services. Diana, improving pain care with the peripheral nerve blocks for surgical patients. Hey, that's a
Love.
clinical, unically. Mm-hmm.
This is amazing. And these are
Mm.
the kind of stories that we want to hear at the conference.
Just
So,
hear this one. Janet
yes.
is saying that patient flow analysis in the health facilities. Wow,
Mhm.
they have a story to tell. Just imagine, they're imagining. Over to you, Barbara.
Thank you very much, James. These are just examples of stories of what you experience in your setting. It's nothing out of the ordinary, nothing big. What are you doing that has created a difference that you want to communicate, and you feel like it will have an impact? So they are simple and powerful, and they can inspire others also in whatever work they are doing. So next slide, please. Thank you
Mm.
so much. Thank you very much for your responses. So, what is an abstract? Because we hope that at the end of this, you'll be able to submit an abstract, and not just an abstract, but a quality abstract that is simple, clearly written, and communicates whatever information you have to the audiences. The whole idea is how you communicating this information. What are the components that are key for this abstract? And we are here to guide you through that whole process. So an abstract is just a summary of information in a document. If you have a manuscript, this is what you'll interact with first. It's the summary of the project that you've done. It is also a snapshot of a case series. It could be a summary of a report or a publication. So it is of fundamental importance that the abstract is written clearly and simply. And the major goal and aim of an abstract is to communicate what has been done. So if it's a project, what did you do? Why was it done? How did you do it? What methodology did you use? What was found? What are your results? What are your findings in whatever work you're doing? If it's a case series you're trying to describe, what are your results in that case series? What is the significance of the findings? And why does it matter, as in to have an abstract? One, first impression, it is the first and sometimes the only part that people read. So you find that if it's a manuscript, that first section and summary is an abstract. And that is a section that will help people either know whether they want to read the whole manuscript or not. So sometimes if the abstract is not compelling, then you're not obliged to go and read the whole paper. If it's a conference, this abstract is what is used by organizers to decide who gets to present. Does it fit the theme? Is it concise? Does it have the key elements? So the conference of organizers will look at the abstracts to see whether it meets the guidelines in submitting. And as we go ahead, Carissa will give us what are the guidelines for submitting to this upcoming conference. Visibility. It makes your work discoverable in databases or journals. When anybody goes to type, and the abstract is what will come out first. And this is what people interact with and read, and to have a feel of what the work is about. For professional growth, writing abstracts help build research and communication skills, because remember, it has to be in a format that can easily be understood by anyone who's reading it. No jargon, and that's why they discourage putting graphs and tables in the abstract. If you have that, you're encouraged to put as an appendix, but the abstract has to be very simple and clear. Real world impact. A strong abstract can inspire change by sharing practical evidence-based solutions from your different settings. You've given us different examples of work that has you've been involved in that has created impact or improved one way or another in healthcare. So if this is put in a right format and communicated in the different formats, then you'll find that it actually creates impacts, and people can use that to sort different gaps or problems that they face in their areas that are similar to what you have communicated in your abstract. Next slide, please. So in summary, an abstract has key important section, and there are 5 key areas. We have the background, the aim, the approach, the results, and conclusion. And as we go on, we'll give you an example of an abstract so that you can have a feel of it. So it's normally very concise, and is between 250 to 300 words, depending on what the requirement is by the different conferences. Different conferences require different guidelines. Like for the second county health conference, I think they require 300 words for their abstract submission. It's normally a standalone summary of the paper, and you write 2 to 3 sentences of each of these topics. So for the background, you normally look at what issues led to this work. What is the environment that makes this work interesting and important? The aim is you're looking at what are the goals of this work? What gaps are you trying to fill? What gaps are being filled by the work that you're presenting? For the approach, or can be methodology, what are you trying to achieve with the aim? What is the method you use to carry out whatever work you're doing? What was the experimental method? Was it a simulation approach? Was it a theoretical approach? Is it a combination? This is where you describe how the work was done. And when you come to results, what were the main results of the studies? And here you include numbers wherever it's appropriate. So you say that you found that there was a reduction of case notification by 30%. You see, you're very specific in terms of the numbers. Here you're just stating what did you find in the field. Then after that, you conclude. And here, what are your main conclusion? Why are the results important? Where will they lead is what you want to summarize in your conclusion. So your abstract is like your ticket to a conference, and reviewers normally use to decide who gets selected based on what you've submitted as your abstract. So it is your chance to share your ideas and achievements with a wider audience. Remember now in the county conference, or even if it's an international conference, you have your peers, you'll have patients, you'll have the community health workers or community advocacy groups, you have researchers. So there are different audiences that will be there. So great abstracts get noticed, and they lead to recognition, collaboration, and even funding opportunities. There are moments when you go to present in an abstract and you get a collaborator based on how you communicated your work. Remember, you have to be very clear and specific what you're trying to communicate to the different audiences. And if it's clear, then I can decide, yes, I'm also looking for somebody who's doing drug discovery in tuberculosis, and I find someone who is presenting on the same, and we collaborate and work together. So it's an opportunity to network, collaborate, and have recognition as you present your work. So, Caris, I think another thing maybe I would like to add is that for healthcare workers, we are always solving problems every day. So whether it's training CHV, it's reducing missed appointments, like what I had mentioned earlier, improving TB follow-up, you're already doing work that is worth sharing. What you're doing is important and is worth sharing. Your abstract will help you turn those actions into formal contribution to the health system, okay? So I'd like to encourage you that if you have done something that has made a difference, and you have had lovely examples that we have in the chat, you already have content for a very strong abstract. It's just now putting it in the right format, in the different sections, and components that are required. So our goal today is to help you shape it and write it and submit it with confidence. And we are available. I'm sure Caris and our other organizers and our Catherine from the county will share our contacts if you need any help in terms of shaping your idea, because you already have the topics you want to communicate. Caris, I'll hand over to you for a practical example.
Yes, thank you so much, Barbara. And to the team, have you noted that all of you have an idea? Those ideas that you wrote on the wall, very interesting. Just to read them through, to scroll through. Please take note of those ideas. We hope that by the time we are done at sunset, you will have translated those ideas, formatted them in form of scientific communication to enable you pass important information. Barbara, is it true that any idea or any work that I've done, I can present it as a scientific output, or I have to think deep in terms of deep science and the rest?
No, Caris. You can present any work. I remember recently we were at a conference in Kigali and presented about field experiences. So we're collecting plants that had medicinal effect on COVID-19. And had not finished with analyzing the lab assays. But we did have a lot of information we collected in terms of our experiences and even how we were dealing with the traditional healers, the communities where the plants are being collected. And that was a paper. And we did an abstract and submitted in the East African Health Research Conference. So yes, you can present on any findings. You can also present on a case series. It's possible. You've met an interesting case series. It's unique, and you feel like this is an area you want to communicate and share. And how what were your approaches in even dealing with those difficult cases? That can be put in a way and a format that can be presented in a conference.
All right, Barbara, thank you so much. Can I disturb you? Now that you have been doing so much systematic reviews, meta-analysis, and I've been learning quite a lot. As I'm looking for an exercise to do, can you please speak about the structure that is on the screen, an abstract structure, maybe highlighting a good thing, the bad thing, that you tell us a story of how the first time you wrote an abstract and the best time. Are you able to write an abstract closing your eyes now? So speak to the screen and give us a bit of your experience in scientific abstract writing.
Okay, story time. So initially, and I think even our experience in the first health and scientific conferences, that the format and the nature of abstract we received were not meeting the different specifications. The half of them actually were rejected because of the quality, because they were, you've been told 300 words and you do more than 300, it's disqualified. If you do not fit the different themes that have been allocated, so maybe this time is I think, Caris, you'll go through the guidelines of the upcoming conference, so that if it's AI in innovation, you're looking at science to policy, maybe knowledge translation. You're looking at maybe real world experience or data in terms of health research. So the themes will guide how you structure your abstracts to submit. Remember, I said it has five key. Remember the 5 key formula? Like when you're cooking ugali, you have to have flour, you have to have water, you have to have some fire, you have to have those basics. If you want, when you add salt or something, it's an additional thing, but there are basics that you need to have when you're writing a scientific abstract. The title. So we need to have, like where it's written abstract will be a title. Let the title be concise, not too wordy, and easily communicates what your paper is about. Background introduction, remember up to two to three sentences. Summarize, have a quick summary of what the work is about, what led to this work, remember, and in what area, why do you think it was of importance. You go to the aim, what was your goal? So you have your background and introduction. After that, you end the background with the introduction with an aim. So why were you doing this work? So that we understand what gap are you trying to fill. From there, sorry, then we'll have to have methodology, like what has been displayed on the screen. How did you do this work? So maybe I'm looking at health seeking. Hello?
Come again. We lost you at some point.
Sorry about that.
You are the aim.
Okay, sorry about that. So with the aim, we want to know what are the goals of the work. What is the gap you're trying to fill with the work you're doing? When you go to methodology, I'll give you an example. Because we were doing some work on leprosy, and we got our aim was to do active case finding of leprosy cases. So methodology will be how are these patients, what was our sample size? How are we identifying them? So we went to the patient register, looked and see how many leprosy patients do we have, where are they located? After that, go to the household, do active case finding and screening. Before that, administer your informed consent. So you give a detail, but in a summary. You can't write everything in that section because you'll run out of the words that have been allocated to you. So pick out the key areas. What are your sample size? What is the methodology you used? Just be concise. And then after that, results. Be specific and to the point, a summary of the results. So we're doing a clinical trial on TB. How many patients did we screen? How many are found to be TB positive? How many are put on treatment? How did they, what was the treatment time? It's a drug clinical trial. How long did it take for these patients to be treated? Because we are looking at reducing the treatment time from 6 months to 4 months. So how many met that time period? How many did not? What are some of the challenges, depending on what your aim was? So that is what you will concentrate on as you're summarizing your results. What is the important data? Because the data you get or the results is a lot. But what are you trying to communicate? What I'm trying to communicate is that there was reduction of treatment period time from from 6 months to 4 months. So how many patients were actually the MTB or TB bacilli were cleared within the 4 months? And that's the data we want to concentrate on. Then my conclusion, be very specific. What do you want to communicate? Yes. It's easier to write the abstract after completion of the paper. So normally when you have your manuscript, you have done your work, you have your manuscript, then summarizing those different sections, because remember, a manuscript will have all these different sections in details. And summarizing it into an abstract becomes very easy. So maybe in summary, that's what I'll say about the abstract. So what we have seen is that you find the title is too wordy, or your objectives do not speak to what your aim was, or your results do not speak to your objectives. You say you're doing a qualitative study, so I'm expecting to see whys or stories, some patient story or a line, but then I see an observational design, you see. So then they do not speak to each other. So you find that your methodology does not speak to your objectives, you see, or to your title. So those ones will just be eliminated. Or you said you're doing you're looking at reducing treatment period of TB, but then you're talking about genetic characterization of the MTB. It does not speak to your title, you see. So those are some of the issue we have found. Or you find the missing information. We don't have a conclusion. Instead, you're writing a discussion, or it's too lengthy. Remember, your conclusion should be very brief and concise and specific. What are you trying to communicate? And that's why we limit the number of words that you can write, so that it can discourage you or different people who are submitting abstracts to write lengthy information that do not speak to whatever work you're trying to present. So maybe that's what I can say in summary, Caris.
Oh, thank you so much for that introduction. Now, I just want to go back and given that we have had that introduction by Barbara, I want us we look at this abstract. And this one, we got it from our scientist here, and we were told there's a conference coming next. There's a conference next week. Can you please write an abstract? And so here is the abstract that was written by one of the one of our staff members, and we say it is a poorly written abstract. Okay. I don't know, Rose, can you see that abstract? Are we able to read?
Maybe you can zoom in
Can I try and zoom in? Let me make it try and
or
14.
increase the font.
As I remove the spaces, let me make it 1.5. Okay. Let me try and increase. And then I want you, all of us, to take just about 3 minutes, just 3 minutes. Here's an abstract. Oh, right. Yeah. So that is remember we were told the various sections. Here is the abstract. It is a poorly written abstract. There are 6 errors in this. I want us to read through and then see whether those sections that Barbara has talked about. I want you to point out as many errors as possible. All right, we have only 3 minutes. Write out as many errors as you can, but basically there are 6. So in your chat box, you'll type them out. All right. Now, background. Just a bit background. So this was a call for abstracts to a conference, and all the instructions were written there. And therefore, this person said they have written this abstract. It was sent, it was rejected, and the commentary there was poorly written abstract. So here we are. Article title, elements of optimal experience. We have suppressed the author's name, but let's call it OO. Abstract. This paper presents a design. If I fall out, please let me know. I'll quickly read through because its abstracts are short and precise. So here we are. This paper presents and assesses a framework IBR and engineering capstone design program. We explain how students' preparation, project selection, instructor mentorships are the 3 key elements that must be addressed before the capstone experience is ready for the students. Next, we describe a way of administering and executing a capstone design experience, including designing workshops and lead engineers. We describe the importance in assessing the capstone design experience and report recent assessment results of our frame world as the most important. Methodology. This was a descriptive design using explorative analysis. The population were engineering students. The results, majority of the respondents, 73%, N is 37, reported they had paid between Kenya shillings 50 and 100 for services. The remainder 27 reported they had paid between 180 shillings to shillings 330. The other cost reported by 3 respondents was laboratory service that costed them between shillings 50 and 180. All payments cash. Conclusion, the IDR framework was not idle for use by engineering students. In 2 minutes, on the chat box, please highlight the 6 mistakes that this abstract has. There are 6, minimum, there are 6 mistakes. I'll try and zoom, let's see, from the title. Two minutes left. There are 6 mistakes. Yeah, oh, right, I can see the comments coming up. Wow. Barbara, I think we talking to the converted. Given the feedback where they are coming in. Very good. You have 1 more minute. 1 more minute left. 1 more minute. Very good. Hey, moderator, this is very interesting. The chat box is alive.
Yes, CBC is working.
I tell you. Hey, 30 seconds left. Wow. I like the way you're pointing out mistakes. Oi, hey. No sample size. Wow. Results do not speak to the objectives. Oh, my goodness. Mm. 10 seconds left. Wow. I'm impressed. I'm talking to the disciples, the converts. Okay. Mm-hmm. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Now, I will not go through the chat box, but I've just been monitoring them as they are coming, and you're all correct. Just imagine that's what we do. When we see there's an abstract and we think we have something to write, we quickly just paste them in there. That is one that automatically disqualifies that abstract. I am going to list them just to see whether we are together. So here we are. The good thing, what is the positive aspect about this is that the abstract was short and precise. From the body, they counted 300 words. And you're told that it should be between 250 and 300 words. The author actually made it 175. So they were trying to be within the word limit. So we give them a mark. Please give them a mark also for responding to the call. All right. So for effort, again, you give them 1 mark. And obeying the instructions, they have something that looks like an introduction. They have something that looks like an objective or an aim. They have a section written methodology. They have something looks like a result, and they have conclusion. The 5 elements of the abstracts are there. So as CBC, give them another 2 marks for effort and for obeying the instructions. Please note, obeying the instructions. The various sections of the abstracts are there. By the way, it was Times New Roman 12. Line spacing was exactly 1.5 as recommended in the instructions to authors. May I say this, that you should be reading whenever there are calls of abstracts or you want to do a publication, please familiarize themselves with the very basic instructions, such as the structure, the conference theme and sub-theme, and also the format. A poorly formatted abstract will be thrown out even before we read the science. And therefore, this paper, I would give it 4 out of 10. They have followed, they have done what we have told them. First things first, keeping it simple and clear and concise in relation to the call for abstracts. So 4 out of 10. But where are the other mistakes? Mistakes number 1, where is the author's affiliation? It's not there. So I don't know whether you can be able to get the author's affiliation, just in case I have to follow up. it's important to have all the authors listed, and the author's institution of affiliation listed there, and may probably email of the corresponding author. Secondly, this paper is deficient with the science, and all of you have pointed out the aim and the objective not clearly stated out. The methodology, yes, he has a study design, which is descriptive, but when you look through, you don't quite pick out the key issues. Then you go to the results. When you look at the results and the objective, they don't speak to each other. Neither do they speak to the title. And then you start, as a reviewer, you start collapsing. And then it goes down, you look at the conclusion. So the conclusion and the objective tend to mirror each other, but not quite speaking to each other. The conclusion is not supported by the results. Neither is the result supported by the title or objective. So this paper collapses on the strength of science. As reviewers, and Barbara will tell you, is that what we look for is that we look at the title, we look at quickly at your objective, we look at the methodology, then look at the results. We should only put in key results that support the objective. And then the conclusion, what do you conclude on that objective? So there is always a relationship between the title, the aim, the results, and the conclusion. When that collapses, your paper is actually we politely send it back with major changes. All right? So it's no longer rejected, but it is now said, look, although you have all this correct, but your results does not support your conclusion, neither the objective. Revise with major changes. So here you are. We will throw out this and give them 4 out of 10, but revise with major changes. If the format was not followed, totally reject the paper. And you politely put a remark down there to the editor-in-chief. Please advise the author to submit in another conference or journal. It's a polite way of saying, hey, just take your things elsewhere. Okay, now that you know, now that we know, no more tears. Barbara took us through that. So there are usually 3 types of abstract. I'll make them very short because of time. Number 1, descriptive. This is basically where you want to describe a process or you have a proposal. They also follow the same abstract, but you realize that there will be no results because it is purely a proposal. But you can also do a descriptive abstract where you're looking at qualitative findings. You did a focus group discussion. In that case, there is a methodology, their results, and their conclusion. Normally, for social sciences, we allow up to between 300 to 400 words, because that's how social scientists are trained to present the results. Then there is the informative or structured abstract. This is the most common scientific abstract that we normally use. It has the introduction or the background. It has a section on the objective. It has methods, results, and conclusion. Colleagues, please take note. You are looking for the powerful points. So in an abstract, you're putting the powerful points. And you're going to see very shortly. Okay. By the way, something else that somebody pointed out, which is very good, abbreviations and references. Abstracts usually don't have abbreviation and references in them because you're just bringing out the key issue to allow us, to allow the reviewers take note. Criteria of a good abstract. And we are going to do one very soon. Number 1, just look at the call for abstract. Formatting, the format or the guidelines provided by the conference organizers carries 50% of the marks. If you can do that, 50% of the marks. So we are no longer going to throw out your abstract, but we are going to, we are going to now subject it to the second level review. So please do not exceed 300 words, but they will guide some, they say 250, others 300. Remember, it is only powerful points. It is one paragraph, one very long paragraph with subsections. And the good practice we normally do is that we bold the subsections. This is the introduction, you bold it. Bold the objective, bold the methodology, bold the subsection on results, and then conclusion. That is one of the things. And because it is a conference, for now, tell us what you have done. So keep it in past tense. Write it in past tense, because it's something that you have already done. Yes, remember you are limited, so long sentences need not to appear. Abbreviate them as shorten them as much as possible. And no, do not cite any references except in very, very, very rare cases. And please note the your results section. Give us the precise figures, but don't put diagrams. Just tell us the figures that need to be looked at. Now, from here, this was just a quick intro, and we want us to do one aspect. I think okay. I'm going to go back to this. Those are the 5 sections. Now, as we almost come to the end of this, you have now learned how a structure of an abstract looks like. You already have most of you have already posted the titles. So let's do it practically. If you have a laptop or you have a paper, a pen and paper, or whatever gadget that you have before you, I want you to open a fresh page. And the title or the idea that you had, you're going to paste it as the running title. Can we get working? Open a fresh page, open Word, or take a notebook and a pen. Write down these various subtitles or the subsections. Remember, we should have a title. Sorry, let me go back to that again. I was looking for that. We should have a title. So your first subsection will be title of the abstract or title. Then we have below it, we have authors. All right. And then we have institution of affiliation below it. These are outlines that I'm giving out. And then contact email of the lead author. Have you got those outline? And then we go to, you can say background or introduction. The next subtitle is aim or objective. I prefer to use the word objective. Barbara loves the word aim, but it's because of systematic reviews. So objective or aim, it's still the same. The other subtitle is called methodology. Methodology or approach. Do we have those? Have you written those ones? And then results. Please bear at the back of your mind, these are key results. So just write their results. And then conclusion. Do we have those outlined? Very good. So we have the title, we have the authors, we have the list of institution of affiliation, email of the lead author, and then we start. we start with either background or introduction. We have the aim or objective. We have the methodology, also known as the approach. We have the results, and we have the conclusion. Now, paste your idea, the idea that you had at the the one that you at the beginning of the lesson that you typed out. Type it out as a running title. Very good. Now, before you go very far, you need to consult the poster that was sent out by the conference organizers, and you choose your track. Which sub-theme are you going to present? That should be at the back of our minds, which sub-theme. Now, when you have the background, we only need 2 sentences at most. Ukipitisha sana ni 3, but the best practice is 2. What is the issue? Remember, you have already posted your up there. So what is the issue? What is the gap? Or what is that best practice? Okay. So we have realized that the referral mechanism is not working. Or yes, I'll use a hypothetical case. So in my background, we only need 2 sentences. Please think of one. And in your sentences, in your 2 to 3 sentences, bring out the key issue or the gap or the issue of concern. So my issue of concern is that the adult male population in Nairobi County present themselves to the clinic with advanced stages or advanced symptoms of TB. So that is the issue. They present themselves very late. This has an implication. My next sentence will be, this has an implication on health-seeking behavior and low adherence to clinical, to care. That is the issue. So 2 to 3 sentences, and then I go to my objective. Your objective therefore states you want to evaluate, or you want to describe, or you want to identify, or yes, you want to identify or describe factors associated with the late presentation of male adults for TB screening in public facilities. You're looking at the factors that cause the delay. Factors that cause, you're trying to explore the factors that cause delay in male patients reporting for screening in public facilities. So the issue here is the delay in TB screening. So I've already have even the objective. So the introduction and the objective is usually a one sentence, one sentence of about 20 words max, not long sentences, about 20 words. So you already have your first 3 sentences in your background and objective. When you come to the methodology, we have to see the 4 things in the methodology. 4, the study design. Is it a case study, descriptive? Is it an observational study? That's the first thing, and that's what makes it a scientific paper. Number 2, where was it carried out? That's the context. Where was it carried out? The third thing we need to see in your methodology, which population? Which was the population? And how were they picked to respond? How were they? So a bit of sampling. So already you have 8 to 9 sentences when you're looking at methodology. The study design, the study site, which population, how were they sampled, the tools, just speak of the tools. If it is a laboratory experiment, please state the method. For example, if you're looking at parasitology, did you use the Cato? Is it the Cato? It's called the Cato principle. Did you use it? Is that what you use? So that one is, you have to tell us the key tools that you did. If it is a questionnaire, was it self-administered or you administered it? If it is focus group, did you use a checklist? So in short, your methodology should have those elements of sampling. How are they picked out? How, or the tools that you use, the data capture tools, or if it is laboratory, the procedure. And the procedure you describe, if there is a unique variation. And finally, in your methodology, please tell us about ethics. Ethics and ethics, how it was observed, how ethics was observed. So, was there consenting, consenting? 8 to 9 sentences. We close the methodology. And finally, now we go to the results. This is where you should have about 10 to 15 slides. Not slides, but sentences, sorry. 10 to 15 sentences when you come to your results. We are looking for the most powerful results. All right? So we are looking for those powerful results. And those are the ones that you describe. In our case study of the male delays in coming for screening, some of the powerful results is respondents did not feel the need for early screening. They were not aware. The other thing you'll discover is that probably another powerful thing is that the self-medication. A simple cough, you did self-medication. All right? And in the self-medication, you also realized that when you had done your further probing, another very important observation in the self-medication is that they were buying a painkiller and cough suppressors. A painkiller and cough suppressors. So they are not actually treating the disease, but they're suppressing the cough because of irritation. And one more other observation in that focus group or in that quantitative findings, you will discover that 80% of the males will always first go to purchase medicine over the counter. That is critical. All right. So you are bringing out critical, what do you call them, data. Do not explain or interpret the data at that point. So you're just putting in the critical data. And then finally, you come to the conclusion. When you come to the conclusion, the rule of the thumb is look at your objective. Look at your objective. Your objective was to document or to explore factors associated with late male presentation for TB screening in a public facility. That was your objective. Pick that objective and paste it in the conclusion and reword it in the past tense. The study, the factors associated with late were self-medication, types of medication, and awareness were the factors that were associated. So you reward that objective based on the observations presented in the results. And finally, so we expect in the conclusion a maximum of 2 sentences, 2 sentences maximum, and 1 sentence on policy implication. What's the implication? It may not be policy, but practice. And when you are doing that recommendation, it is a 1 sentence recommendation that the county government health department should increase or heighten public health awareness, specifically designed for adult males, who are suspected to have a cough suggestive of TB. I will say again, the recommendation is a 1 sentence. It's a 1 sentence write-up, and it should be very specific action. That's what I'm looking for. It's action, but to whom? So we are saying that this one we are directing to the Nairobi County Government Health Department. That's the whom we are targeting. To do what? To heighten public health awareness, specifically designed for, specifically targeting the adult males who have a cough that is of more than 3 days. Full stop. And then below it, then you have keywords. But the keywords are never counted. But it's good to have keywords at the bottom. Now you have an abstract. Allow me, just so that we will do it very quickly. Once you have that, I want to do something else here. And then so that for those who will drop off, AI. All of you have heard about AI. And I'm going to show you the AI so that you stop, moderator, so that they stop, having struggling. The moment you have your abstract in its raw form, you type in everything along those lines. All right. So you're going to type in the abstract. Don't worry about the words for now, but you already know, you have already posted the keywords. Go to your chat GPT or any other AI that you use. And then you ask it to, you can ask, for me, I would ask to rewrite the following or the attached abstract, or to write the attached abstract into scientific, rewrite the attached abstract in a formal way. In a formal way, all right? Using the headings, introduction, objective, what was the other one? Methodology. I'll use it. Subsections. Okay, using the subsections, methodology, objective, methodology, results, conclusion, and recommendation. Maximum. What was the maximum? Maximum of 300 words. Your AI, if you use it frequently, it should be able to rewrite for you that abstract and shorten the words. So it will also, the AI will correct for you the grammar. This is a word of caution. AI is usually 80% clever. It's 80% clever, but it has a problem. All right? 20% can be exaggerated. So the moment it writes for you, please take time and revise your abstract again. All right. All right, I'm trying to pick out one here. Okay, I may not have one. Let me see whether I have abstract. I'm trying to see. This is how what will happen. So here's an abstract from Makweni. You can see they have written all this. So I'll take this Makweni paper. And then I'll just post. You can either do it as an attachment or you post. You can put it there. And let's see what it has done. So please take note that this is the first one by this group from Makweni, who are looking at predictors of intimate partner violence. And then they have put all their what do you call it? They have typed in, because they know the sections. You already know the sections, the various sections, but the wordings is too much. And at times the grammar is not good. So let's keep it simple and straightforward. So once you do that, go to your AI. It could be your Chat GPT, it could be your Bing or any other AI. That you instruct it. And if you cannot instruct it, you can actually use, say, using the attached call for scientific abstract. Let me call it, scientific abstract. Rewrite the following abstract. Rewrite the following abstract. So you'll have to attach. You must first attach you must attach the call for abstract first. So you'll go. I haven't downloaded the call for abstract from Nairobi. That is what your AI is going to read. All right. And then below there, you have already pasted your abstract. So you can see my abstract is there. But the first thing the AI is going to do, okay, mine is stuck, but it's all right. Oh, sorry, it was already at the top. Sorry about that. So you first attach the call for abstract. The AI is going to read the instructions, and then it is going to read your abstract and present it that way. So everybody can write a story, and you can move from 4 out of 10 to 8 out of 10, because the highest mark we always give is either 8 or 9 out of 10. Nobody gets 10 out of 10. The beautiful thing is that already the AI has formatted for you based on the results that you have provided. It does not go out of what you have provided unless you now continue. For example, it's telling you, do you want to optimize for academic journal? You say no, because when it goes that, it's going to introduce things that were not there. All right? But remember, your objective, your results and conclusion must speak to each other. That is the critical association. And I will repeat again, take your objective, put it at the bottom, and write a sentence based on the results around that objective. So it's no longer an objective, but you will drop some keywords. Like this one was to determine the prevalence associated with this. So I would start, when I look at the results, the results, it says that for the prevalence and the types associated, you can see it is the issue of gender was strongly associated with mental disorders, particular depression, that and that by that. So it has already concluded on the objective. And when you look at that, you can actually see some of the results there, and you have tied it up with your title. You can always adjust the title in case. Put it in AI. Remember, the AI is 80% correct. Revise and then paste it. Within 30 minutes, maximum 1 hour, your abstract is uploaded, up and ready to go. Aya, it's now going to 3:30. Moderator, I will stop here because the next part is that we should have now done, everybody should have done one right now. They put in the various sections, save, upload to AI, and voila. Please remember to check the call for abstract, the sub-theme that you'll be responding to. It's very important so that you tailor make your conclusions and recommendations to speak to along those lines. Keep it short, keep it powerful. We are looking for the powerful points. All right. I'm handing the meeting back to the moderator. Dr. Rose, take it from here.
Wow. Thank you so much, Team Camry, James and Barbara. It has been very well articulated, informative, and eye-opening, I believe, to every one of us. And as you said, the aim is for us to submit quality abstracts. I think the audience should give us a hard time at the county in selecting the abstracts that will make it to the conference, because I believe we'll all present quality abstracts following this informative session that we've had. So we appreciate so much James and Barbara for sharing that knowledge with us. And I was just checking through the chat box, and I think before I see if we've any other questions, I would like Barbara to respond to Joe's question live. I know you chatted in the chat box about the difference between the aim and the objective. Barbara, if you can hear me, as we do that, the audience can check on the chat box. A link has been shared. The link will lead you to the platform where you can create an account and submit your abstract for the upcoming Health Scientific Conference for Nairobi County. Yes, Barbara, you can respond to the difference between aim and objective briefly.
Okay, thank you very much, Rose, and thank you, Joe, for that important question, because you're seeing that many people use this term interchangeably. So some assume that they actually mean the same thing, but there's a small difference between the term aim and objective. So aim is normally broad. You're just giving an overall picture of what you want to do. So like I gave for an example, let me just look at an example we did for one paper for the leprosy. So the aim here, we are looking at to determine factors contributing to delayed leprosy diagnosis in Kwale and Kilifi counties in Kenya. Very general. The objective, remember, an objective has to be very smart, specific, measurable, achievable. It can be achieved within the required timeline, and all the intricacies we always use for objective. It has to be smart, very specific. So here, for example, we can say, let me see the example I gave here. So to assess the impact of SMS findings on appointment attendance among the TB patients. So here, what are we doing? We want to assess the impact of SMS reminders, yeah? And we want to see whether this will affect attendance among the TB patients. So very specific, not as general as the aim has been stated. Another example of objective, it will be something like characterize common chronic respiratory diseases encountered in hospital, outpatient clinic departments in maybe 3 African countries. If we turn this to an aim, then we're looking at chronic respiratory diseases in adult outpatients in 3 African countries. So you see the difference. Aim, we would like to look at chronic respiratory diseases among adult outpatients in 3 African countries. Objective, we want to characterize, so what are the common chronic respiratory diseases that we encounter in these clinics, and you mentioned what clinics they are. So you're very specific in terms of your objective. Your aim is broad. I would say that in short.
Thank you very much, Barbara. And then James, I knew the question of AI will come. Someone is asking, is there a chance that AI may increase the similarity index of my abstract? James?
Oh, that's a nice one. Oh, okay, similarity index. Yes, it's an AI. But one of the things that we always say is that if you provide it with already what you have written, and you instruct it based on how you're going to instruct it, it can actually focus only on that, because context is the issue. However, if you do not instruct it properly, it is also going to pick from the general web, and that increases similarity with others so much that if it is put on a plagiarism check, it will almost be a disaster. Remember, plagiarism is checking whether you copied other people and work and passed it as your own. But what we have just done a few minutes ago, this is our own idea. These are our results. This is what I have presented. This is an ongoing activity. For example, last week we were looking at what we call sentiment analysis for Social Health Authority, that is SHA, from online users. Very, very similar. Somebody else had said social health insurance online users from Vietnam. Very similar. And you wonder why. But what makes the distinctive difference is in our methodology and presentation. The methodology and the results section made the two papers totally different. The approach was different. The methods of analysis. The Vietnamese team used SPSS or statistical analysis, as we used the data science methodology. So things were very different. So similarity is possible. I usually advise my colleagues here, the more you use the AI, the more it learns on how to what you like best. So it will respond to that. It's called restriction. You restrict it. I submit.
And to
Thank
add
you.
on that, sorry for interrupting, Rose.
Yes, Barbara, you can go ahead.
To add on that, garbage in, garbage out. What you feed the AI is what you'll get. So if you're specific with your different items, like what we did in this paper, then what you get as an output will not be similar. There'll be a few changes or a few differences or a few things unique to your paper. If your question was general, for example, what was the title of this work, Caris?
This one.
Yes.
Hii walikuwa natuambia nini? Ngoja tukwambie tu sahi. The title of this from McWayne was Predictors of Intimate Partner Violence in Patients Attending the General Health Service at a rural health facilities in Makueni County, Kenya.
Okay. So for example, now you go to your AI and just put, draft from you an abstract on predictors of intimate partner violence in patients attending a general health service at a rural health facility. And you leave it at that, or you just do predictors of intimate partners, just the first part of it. So you see, you've not fed it with any other information like objectives, how the analysis was done, what your results are, your conclusion. So what the AI will do is that it will pick what is out there. And so the similarity index will be higher.
Barbara, just come again. What the way you are saying it? You ask the AI to do what?
So if you type now on this AI, it will actually respond to what you've already, because you've already prompted it.
So how will I type?
if you type it now, Caris, you'll still get whatever you have written because you've already prompted the AI. So it will use the data that you have put there.
Okay.
But if I do a fresh search as Barbara, and I look at, give me that title again.
Okay, I'll give you in a moment. It's on your screen.
So if I, Barbara, go to ChatGPT and write predictors of intimate partner violence in patients attending a general health services. Yes. So I put that in my AI to do for me an abstract, and I give it all I do is that I want an background, aim, methodology, results, conclusion, and I don't feed it with the information like what you have done with this paper. What the AI will do is that it will pick information that is out there. Yeah, it will synthesize what is out there, and then the similarity index will be higher compared to this where you've been very specific. Makueni County of Kenya, you have already objectives, you already have your methodology, you already have your analysis, you have your conclusion. So it will work with what you're fed it. So if you're not specific with what you feed the AI, then it will look for whatever is out there and synthesize the information that is available. If you specifically input what you want and you already have something you've already pre-written, then it's easier that what comes out as an output with the AI, it will be less similar than what is available because you've been very specific on different sections. So that is the difference, or with AI, what you feed it is what you get. So like Caris, if you are to put an open question now in that AI, it will still respond to what you, because you've already given it details to begin with. And so that is already it's in its database. So it will structure it based on what you've already given it, which is available to it. So what you get from that search and what I get from the same search will be very different. I submit. Thank you.
Okay, thank you, Barbara and James. I'm still checking the chat box and the Q&A. Someone was asking the impact of an organization speaking that you have used AI in your submission. Is there any penalties for that?
I think it depends. Nowadays, some journals or rather even conferences, they tell you to declare if you used any AI. So they actually allow the use of AI, but you have to declare that you used. And to what extent did you use? Is it you used it to generate all the information, or you did feed it, whatever you did, 80%, and then AI was to help you restructure it? So some conferences now do accept the use of AI, but you have to declare.
Yes, and just to add on to what Barbara said, when you are declaring, just say that you used AI to edit. That is now very specific declaration. Just to emphasize on what Barbara said. So that's when you are told to declare is the extent. So I only use this AI to format to the 300 words, but all the rest is my original work. All right, remember, they may also cross-check just to say that they can subject your abstract to an anti-plagiarism to see whether exactly what you said means. Okay, but that's a trick for another day. If you invite me, you'll come and do some little tricks. Okay, Chair, I submit.
Thank you, Caris. We hear you. I think we need to benefit more from your pool of knowledge, and we hope we'll engage you further beyond this webinar. I see it's 3:30, and from the chat box, I can't pick a question we've left out. And maybe because of unanswered questions or unasked questions, I would invite Dr. Kate to briefly give us some remarks on frequently asked questions that we've not addressed in this webinar. Then we can end it after that. Kate?
Yeah, good afternoon, everyone. Thank you so much, Dr. Thuo, and thank you, James and Barbara, for taking us through a very informative presentation and quite engaging. So I'll just take us through the frequently asked questions that are pertaining to the upcoming conference. So the first asked question is, number one, what is the Nairobi Health Scientific Conference? So the Nairobi Health Scientific Conference is an annual flagship event that is hosted by Nairobi City County to foster collaboration, research, dissemination, and policy dialogue across the health sector. It brings together policymakers, health professionals, researchers, students, civil society, and partners to advance universal healthcare coverage and the Sustainable Development Goals, SDGs, for Nairobi. The second FAQ would be, who should attend the conference? So the targeted participants include healthcare workers, researchers and academics, students, both undergraduate and postgraduate, policymakers and government officers, international organizations and civil society, development partners, NGOs, and private sector actors involved in health systems strengthening. The next is, what is the theme for the 2025 conference? So the theme for this year's conference is advancing universal healthcare coverage towards the attainment of Sustainable Development Goals 2030 for Nairobi. I'll repeat that, advancing universal health coverage, UHC, towards the attainment of Sustainable Development Goals 2030 for Nairobi. Then number 4, what are the sub-themes and tracks for the 2025 conference? So there are 6 sub-themes for this year's conference, and I'll just list them down. The first one is innovation and technology in health. Number 2 is sustainable health financing. Number 3, genomics and emerging science in health. Sub-theme 4, population health and health system strengthening. Sub-theme 5, environmental and climate change. And sub-theme 6, partnerships and collaborations in health. So under each of these sub-themes, we also have tracks. So I'll just give us some examples of the tracks which are falling under these sub-themes. So AI and digital transformation, we have a track on health financing models, clinical trials, RAMCA, mental health, climate resilient systems, and public-private partnerships. Then number 5, how can I participate in the conference? So you can participate by submitting abstracts for oral or poster presentations. You can also attend plenary, scientific, and panel sessions. You can also join the workshop, side events, and symposia. You can also come in to exhibit as an exhibitor to exhibit innovations. Then you can also engage us as a sponsor or partner. And finally, you can network with national and international experts when you attend the conference. Then the next question is, what are the expected outcomes of the conference? So as a participant, you will be able to contribute to the national and global UHC agenda. You'll also be able to publish and disseminate your research findings. Then you will also be able to showcase innovations and health solutions. And the last is strengthening partnerships and dialogue across the sectors. Then the next question is, how do I register for the conference? So you can register for the conference by visiting the official conference portal, which is on the county website. And my colleague, Dr. Kibera, has put the link in the chat box, but I'll just read it out. It's https://nairobi.go.ke, the second Health Scientific Conference, Nairobi City 2025. There it is. Thank you. Then the next one is, what are the registration fees? So for local delegates, if you register early, that is before the conference day, you will pay Kenya shillings 18,000. And then for on-site registration as a local delegate, the fees is 20,000 Kenya shillings. For international delegates, the registration fee is 250 USD. Then for students and intern delegates, the registration fee is 12,000 Kenya shillings. Then for the LMIC delegates, the registration fee is 150 USD. Then the next question is, how can I make a payment? So payment options include, number 1, through mobile money. So we have a pay bill number, which when you go to the county website, you'll be able to get the detailed information on how to proceed to make the payment. The next is through credit card or a debit card, then through a direct bank transfer, and then all details will be shared through the conference registration platform. So currently we have some information on the county website on how regarding the fees and like how to make the payments, but the registration form will be uploaded in the next coming days. Then the last question is, what if I have further questions? So if you have further questions or for more information, you can email us at info@nairobihealthconference.co.ke, or you can visit the county website, which is listed there. Thank you. I'll hand it over back to the moderator, Dr. Rose. Thank you.
Thank you so much, Dr. Kate. And it has been an interactive and informative afternoon. And I thank all of us for taking part in this information webinar, beginning with our audience. Your attendance was in high numbers, and I hope we have impacted your knowledge on abstract writing, not only for the upcoming Nairobi Scientific Conference, but for any other area that we may need to write abstracts. I also thank KNHUN for giving us this platform today. We appreciate and we look forward to future partnerships with you. And Kemri, we thank you so much, James and Barbara, for being our speakers of the day. And your knowledge is something to look for often, and they will always come back to you. And I could see the audience looking for your contacts. I hope you shared them, because I think we've all been lost in abstract writing and wondering why our abstracts don't go through sometimes, but not anyone who has been in this webinar because of your input in your presentations. Thank you so much, and God bless you. We can't forget the Nairobi County government, especially the committees behind the Health Scientific Conference. We thank you also for the efforts and making this a success. And I wish all of us well in our research areas and in our writing of abstracts, because going forward, we'll have quality abstracts because of this webinar. We will have another information webinar on 18th of August. We will share details. Keep following our website as shared in the chat box so that you can have more details on our upcoming events. Thank you, everyone. Once again, I've been your moderator, Dr. Rose Thuo. I work with the County Government of Nairobi. Thank you so much and have a good afternoon.
A huge thank you to the team from Nairobi County and also to the team from Cambridge. Just to inform you that this session has been recorded and will be uploaded to our YouTube page, that is at KNH Research. You can search that on YouTube, or you can search for KNHUN webinars and you'll be able to access this and past recordings. Thank you for being with us this afternoon. We will be back and we'll send information over via email on for the event on 18th. Do have a wonderful afternoon and goodbye.
Goodbye.